The dark side of news: how media affects your mental health. Tips for staying informed without doomscrolling. The dark side of news: how media affects your mental health. The hidden toll of bad news: how media coverage impacts our mental health. Let's face it, everywhere you turn, the headlines seem to scream disaster. From the relentless updates about the coronavirus pandemic to stories of war, political unrest, terrorism, natural disasters, and tragic accidents, it can feel like we're drowning in a sea of negativity. But here's the part most people overlook: what is all this constant exposure to bad news really doing to our minds? We rarely pause to consider how this non-stop barrage of distressing information might be shaping our emotional well-being. For some, the weight of negative news can feel overwhelming, fueling anxiety, insecurity, helplessness, and even symptoms of depression. Others might find themselves emotionally shutting down, becoming numb or detached as a way to protect themselves from the pain and stress these stories evoke. Every day, we encounter events, both big and small, that can influence our mood and, by extension, our mental health. While it's important to stay informed, there's a growing argument that media outlets should also strive to create more positive, uplifting experiences for viewers. According to Deci and Ryan, 2008, programming that encourages positive emotions and minimizes negative ones can play a crucial role in supporting mental well-being. But is this really happening? The science behind media and mood. Researchers have long been interested in how the emotional tone of news coverage affects our mental states. Studies suggest that when television programs focus heavily on negative content, they can trigger significant changes in viewers' emotions, though the impact can vary depending on individual personality traits. And this is the part most people miss: the emotional response we have to the news often depends on the dominant themes being presented. It's no secret that many news broadcasts prioritize negative stories over positive ones. The logic? Negative news grabs attention and keeps viewers hooked, creating what Lewis, 1994, described as a spiral of negativity and curiosity. But here's where it gets controversial: does this focus on bad news actually serve the public, or does it just keep us glued to our screens at the expense of our mental health? Interestingly, some evidence suggests that too much negativity can backfire, causing viewers to lose interest or tune out altogether as a way to avoid emotional overload. Klein, 2016. Negative news, anxiety, and depression. Multiple studies have found that watching news programs dominated by negative stories can increase self-reported levels of anxiety and depression. This exposure can also encourage a tendency to catastrophize, essentially, to imagine the worst possible outcomes for our own lives, even if the news isn't directly related to us. When we're anxious or depressed, our brains are more likely to focus on threats and negative information. This can lead to errors in how we process what we see and hear, making us more sensitive to danger and less able to see the bigger picture. The role of rumination. Here's a fascinating twist: our mental state can actually prime us to pay more attention to threatening content, especially if it matches the issues currently dominating the news cycle. Wells, 1994. For example, someone already feeling anxious might be more likely to fixate on stories about health risks or violence, which in turn reinforces their negative mood. Depressive states, in particular, make it easier to recall memories that match our current feelings, so if you're feeling down, you're more likely to remember other times you felt threatened or sad. Matthews and McLeod, 1994. This creates a feedback loop that can lead to chronic worry or rumination, where negative thoughts become hard to shake. And this is the part that could spark debate: does the media have a responsibility to break this cycle, or is it up to individuals to manage their own reactions? Some researchers argue that people who tend to ruminate, those who get stuck in cycles of worry, are more likely to recall catastrophic scenarios in response to questions like, what if? Vassi and Borkovic, 1992. Their minds are primed to expect the worst, and negative moods can trigger these thought patterns, making it even harder to escape the spiral of worry. The broader impact of negative news. It's not just the specific topics, like war, poverty, or pandemics, that cause us to ruminate. The effect of negative news seems to spill over into other areas of our lives, making us more likely to worry about unrelated issues as well. So, what can be done? For the sake of viewers' psychological health, it's crucial for media producers to consider the emotional impact of their programming. The way news about pandemics, for example, is presented, whether it's through alarmist language, misinformation, or constant real-time updates, can push people into states of anxiety, fear, and helplessness. But here's a controversial point. McKeon, 2020, observed that news about infectious disease outbreaks can provoke levels of fear and anxiety that are wildly out of proportion to the actual risk. Does this mean the media is fueling unnecessary panic? Final thoughts. Where do we go from here? As we navigate an era of 24/7 news cycles and instant updates, it's more important than ever to be aware of how media consumption affects our mental health. Should news outlets be held accountable for the emotional fallout of their coverage? Or is it up to us, as viewers, to set boundaries and seek out more balanced sources of information? What do you think? Do you believe the media is doing more harm than good by focusing on negative stories, or is it simply reflecting the reality of our world? Share your thoughts in the comments. Let's start a conversation about how we can all protect our mental well-being in the age of information overload. Tips for staying informed without doomscrolling. Breaking news or breaking you? If the endless stream of alerts feels like emotional whiplash, you're not alone, and you don't have to choose between doomscrolling and burying your head in the sand. Most of us genuinely want to be informed citizens, yet the 24/7 news cycle can quickly morph into a mental health hazard. That uneasy feeling has a name: news fatigue. Psychologists define it as the exhaustion and anxiety that build up when our brains process crisis after crisis with no rest in between. But here's where it gets controversial. Does stepping back from the news make you less responsible, or is it a necessary act of self-care? To unpack that question, Reset sat down with two people who spend their days helping Chicagoans stay both sane and engaged: Alexa James, Chief Executive Officer of NAMI Chicago, and Stuart Shankman, a psychologist at Northwestern Medicine. They agree on one big point: staying informed is important, but so is protecting your mental bandwidth. James suggests setting news boundaries, the same way you'd set work-life boundaries: scheduled check-ins, trusted sources, and a clear cutoff time each evening. Shankman adds that curating your feed can reduce the urge to doomscroll. Think of it like choosing a balanced diet, a mix of local reporting, national context, and yes, the occasional good news story for dessert. And this is the part most people miss: the headlines you skim can have very real consequences for Chicago. Take the GOP's latest tax and spending proposal. Analysts warn it could squeeze Illinois budgets and limit Medicaid coverage by adding new eligibility requirements. Medicaid isn't just a statistic, it's the safety net that pays for doctor visits, prescriptions, and hospital stays for nearly 1 in 4 Illinois residents. Cutting that net could leave thousands scrambling. Meanwhile, Reset has eyes on other urgent stories: an investigation into a tragic mass shooting within city limits, and the city's plan to replace every lead service line delivering drinking water. Children born today will be middle-aged by the time the last pipe is swapped out. Sparkling example of how infrastructure timelines can clash with public health urgency. So where does this leave us? You can be both informed and emotionally healthy by setting time limits, diversifying sources, and remembering that every headline represents real people and policy choices. Big questions for you. Do you believe taking deliberate news breaks is responsible citizenship or quiet disengagement? Should Illinois push back harder against federal proposals that threaten Medicaid, or are stricter requirements overdue? And finally, is a 40-year timeline acceptable for removing lead pipes, or is that pace downright negligent? Chime in with your thoughts. We genuinely want to hear every angle. The dark side